Hi, Dr. Virunji here from Vida Healthcare, and today I'm sharing with you one of the other questions that so many people have been asking, both from the social media platforms of mine, or sometimes phone calls, or sometimes emails. And this is peptic ulcer disease, or what people commonly call ulcers. This video is sponsored by C247 and Complete. Please go to www.vidahealthcare.com and grab yourself some of these supplements, because with what I'm going to share with you, that information is very vital. So, going to the discussion, peptic ulcer disease is an illness that affects your stomach and affects your duodenum. Those are organs you have in your body that break down food or help you do food digestion. So, why is this illness commonly talked about? Because it's common things occur commonly. Very many people sometimes these days are used to saying, me, I know I have ulcers, I don't do this, I don't do this, I don't do this, I have ulcers and I know. But what are you doing about that illness? Because if you don't do something about it, soon or later you're going to have other complications that are arising out of it. So it is important that at Vida Healthcare we talk about this, we discuss some of the interventions you can do. You know how the disease can come and how you can be able to help yourself, to help your loved one, minimize or prevent the complications I'm going to talk about. So, commonly, peptic ulcers is caused by an infection of H. pylori. It's a bacteria that usually goes to your stomach, and then the different reactions that bacteria sets in motion can cause wounding or an erosion to that to the normal lining of the stomach, and so you have a wound or you have an ulcer. That's why it is called an ulcer disease. Common complications that can arise out of it can be pain, you can have bleeding, you can have vomiting of blood, you can have very dark stools because of that bleeding that is happening. So how can you be able to prevent it? One, the management that we know of peptic ulcers is treating the infection if you have the infection, and then managing the ulcers, the increased production of the acid, stomach acid, and neutralizing that acid so that those wounds can heal. If you take out the infection, those wounds can heal. There are also some drugs that we know increase the risk of suffering from peptic ulcers. An example is diclofenac and the other categories called non-steroidal anti-inflammatory drugs. So if we take away those, it is also known that the impact that peptic ulcers has on you is going to decrease. How do you know that you have ulcers? Sometimes when you have that pain, you can go to the hospital and the doctors can be able to do a diagnosis or can check you, and then they can prescribe for you medicine. The other reason is that when you give your body antioxidants, when you give your body alkaline products, alkaline foods, you're able to neutralize some of that acid, and you can promote healing of those ulcers wounds. So that's why Vida Healthcare, we recommend C247, we recommend Complete, because those are some of the most powerful antioxidants or alkaline products that you can use alongside the conventional medicines that we know from hospital. You can go to www.vidahealthcare.com to find out more information about peptic ulcers, but you can also follow us on our social media platforms. We have YouTube, we have Facebook, we have Twitter, we have Instagram. You can also send us a message on our WhatsApp number. It is showing below. You can be able to see the number, and you can send us a message on how you can be managed or how your peptic ulcers can be controlled. I'm here to say cheers to good health as you check out Vida Healthcare services.